Assalamu alaikum. I'm Professor Dr. Hayder Mubarak. This is a practical presentation to the topic of anatomy of the submandibular region or submandibular triangle and the teeth. The submandibular triangle had been studied previously with the section of the anterior triangle of the neck. The submandibular triangle is one of the four triangles in the region of the anterior triangle. We have curved triangle, muscular triangle, submental and submandibular triangle. This submandibular triangle is bounded by the anterior and posterior bully of the gastric and also is bounded by the lower border of the body of the mandible, which is the base of the mandible. And this triangle, the submandibular triangle or submandibular region, contains mainly the submandibular salivary gland. If we want to expose the submandibular triangle, we will see that exposure in anatomy during dissection of the submandibular triangle or submandibular region shows four layers of soft tissue starting from superficial and to deep. The first layer is the skin, and deep to the skin is superficial fascia, and you know this region of superficial fascia contains a muscle which is called the platysma. And also here in the superficial fascia we may see mandibular and cervical branches of facial nerve. And deep to the superficial fascia with its content, the first layer of the submandibular triangle contains also the investing layer of deep cervical fascia. So the first layer is representing the roof of the submandibular region or submandibular triangle, formed of skin, superficial fascia and its content, and the deep investing cervical fascia. Deep to this first layer, which is the roof of the submandibular triangle, the second layer contains vessels and nerve. The vessels are the facial artery and vein, and the nerve is the hypoglossal nerve. And the facial artery or facial vein gives here submental artery, which is supplying the submental region. Deep to this vascular layer, the second layer containing the facial artery, vein, and hypoglossal nerve, deep to them is the third layer. The third layer actually represents the floor of the submandibular triangle, containing the following muscles from anterior to posterior. First, mylohyoid. More posterior and deep to mylohyoid is hyoglossus. So anteriorly and more superficial is mylohyoid. Posterior to mylohyoid and deep to it is hyoglossus. And posterior to hyoglossus and deep to it in this region behind the dotted line is a small region here formed in this layer, the third layer, the floor, by the middle constrictor muscle of the pharynx and by styloglossus muscle. You know that the pharynx has superior constrictor, middle constrictor, and inferior constrictor. This region is formed in the third layer, the floor layer of the submandibular region by the middle constrictor muscle. In this layer, the third layer, which is the floor, hyoglossus is considered as a key muscle in the submandibular region because, as you can see here, there are some structures superficial to it and there are some structures deep to it, which are hyoglossus. So, superficial to hyoglossus, which are the key muscles, are the structures that seen or denoted here by the red arrow. Superficial to hyoglossus, this is hyoglossus. Superficial to it, we may see the hypoglossal nerve, denoted here by the red arrow, the lingual nerve, and the duct of submandibular salivary gland. While deep to hyoglossus are the structures denoted by the green arrow, which are the lingual artery, the glossopharyngeal nerve, and the stylohyoid ligament. The fourth layer deep to this floor, deep to the third layer, is seen here. It is formed by the deep part of submandibular salivary gland and also by the sublingual salivary gland and also by the submandibular ganglia supplying these glands with parasympathetic fibers, and there are here also some vessels that are below the tongue and so are called sublingual vessels. Now we will describe this gland, this salivary gland, which is J-shaped gland. It is the submandibular salivary gland. The submandibular salivary gland is a mixed serous and the mucous salivary gland. We had learned that the parotid gland, for example, is a pure serous salivary gland. Here the submandibular salivary gland is a mixed serous and mucous salivary gland. It is J-shaped gland because it is formed of a superficial part and deep part. These two parts are connected at the posterior border of mylohyoid muscle, as you can see. So this is the shape of the submandibular salivary gland. From the deep part of submandibular gland, which is this part, a duct is originating, which is duct of the submandibular salivary gland. The duct of the submandibular salivary gland, which is originating from the deep part of this submandibular salivary gland, run forward medial to the sublingual salivary gland, and then it is opened in the apex of a papella that is deep to the tongue, which is called sublingual papella. The position of the sublingual papella, where the duct is open, lies deep to the medial part of mylohyoid muscle and the anterior belly of digastric. You can see that the duct of submandibular salivary gland and the deep part of submandibular salivary gland lie, both of them, between the mylohyoid muscle and hyoglossus muscle. While the superficial part of the submandibular salivary gland is related superolaterally to mandibular fossa, that is on the medial side of the body of the mandible, and also related superolaterally to the angle of the mandible, medial side of the angle of the mandible, where medial pterygoid is inserting. So superolaterally, the superficial part of the submandibular salivary gland is related to the mandibular fossa on the body of the mandible, and also is related superolaterally to the insertion of medial pterygoid muscle. Blood supply of the submandibular salivary gland and sublingual salivary gland is via the facial artery and lingual arteries, which are adjacent to them. Nerve supply to the submandibular salivary gland is by the submandibular ganglia. We had described 4 parasympathetic peripheral ganglia in the head and neck: otic ganglia, pterygopalatine ganglia, ciliary ganglia, and now we will describe the submandibular ganglia as one of the 4 parasympathetic ganglia of the head and neck. The axons of neurons in the salivatory nucleus of the medulla oblongata, in the medulla oblongata, we have a nuclei which are called salivatory nuclei. Axons of these salivatory nuclei, the superior and inferior salivatory nuclei, pass with the facial nerve, and then these axons of the salivatory nuclei leave the facial nerve and running with the chorda tympani branch of facial nerve. The chorda tympani had been seen in the infratemporal fossa. It is connected with the lingual branch of mandibular nerve. So the axons of the salivatory nuclei then run with the lingual nerve, and via the lingual nerve these axons reach the submandibular ganglia and connected with the neurons of this ganglia. Axons of the neurons in the submandibular ganglia supply the sublingual and submandibular salivary gland with parasympathetic innervation coming from the salivatory nuclei, and also the submandibular ganglia supply these 2 glands, the submandibular and sublingual gland, with sympathetic fibers coming from the superior cervical sympathetic ganglia of the cervical sympathetic chain. Regarding clinical condition, you have to know something about the submandibular abscess collected here that must be drained, and something called Ludwig angina, and it is demonstrated well in your theory. Regarding the structure of the tooth is formed of 2 parts: a crown that projects above the gum and a root that is inside the gum. The crown is covered from outside by the white enamel, while the root that is inside the gum is covered from outside by the cementum. And inside the enamel and inside the cementum, the enamel of the crown and the cementum of the root, is a substance which is called the dentine. The dentine contains the pulp space and root canal space. The teeth has certain names. We have 4 incisors, 2 central and 2 lateral incisors. More posteriorly we have 1 canine on each side, and then 2 premolars and 3 molars, and thus the total number of the teeth in adult are 32 teeth, 16 teeth in the upper jaw and 16 teeth in the lower jaw. Thank you very much.